gentlemen, karibuni sana katika our 165 session about today we'll be talking about how trauma affects our brain and behavior. I am very sorry and my apologies. My name is Monaisha Kuania and I have a cold. Kwa hivyo kwa namna moja ama nyingine my voice itaweza kwamba umesikia imeshikwa ama hauisikii vizuri, so I beg to be forgiven for that. Na kwa wale wengine ambao tuko hapa and we have the same cold ambao tunaizipata kwa namna moja ama nyingine because of the weather changes, poleni sana na tukunywe sana the concoction na to make sure kwamba tunajiprotect tusiweze kusambazia wenzetu the cold that we are suffering from. So today ikiwa 165 session, we have our beloved guest ambaye ataweza kutuongelesha how trauma affects our brain and behavior, and because ni jambo ambalo ni la muhimu tuelewe why people behave in a certain way and how our brain is working, putting in mind ya kwamba the effects of trauma ambazo tumezibeba since we were born hadi leo. So karibuni sana, and because of that nimesema pale mwanzo, feel free to use our chat box to comment, to react, and also to share experiences in one way or the other ambazo you feel you are comfortable of sharing and are also able to share so that other people can learn from your experiences. Remember, this is a safe space, and we believe ya kwamba whoever is here ataweza kuhold space for the others ambao wapo hapa ndani katika hii platform yetu. Every Tuesday, this is what happens from saa 2:30 hadi saa 3:30. And today tumepata mrembo ambaye ni counseling psychologist Brenda Onyango, ambaye amekuwa our regular guest, amekuwa akifanya kolabo na dada yetu Doris, na pia yeye ameweza kufika katika this platform akiwa kama solo guest, na today tumebarikiwa kuwa naye. So I will give this chance to dada Brenda to introduce herself and tell us.
Okay, thank you so much,
Karibu sana Brenda.
Okay, thank you so much Mwanaisha na kila mmoja wenu ambao amepata time kujoin. Good evening everyone. My name is Brenda Onyango and I'm a counseling psychologist and I practice as a counselor. So today tumebarikiwa kuwa hapa. Mwenzangu Doris pia atakuwa, nimeona ako on and off, but atakuwa pia part of the session. So thank you so much and I'm happy to be here. Back to you Mwanaisha.
Thank you, Brenda. And info and karibu sana once again to this platform, and thank you for always being there to make sure ya kwamba unatufunza namna moja ama nyingine. And also karibu sana Doris, nimekuona, na any psychologist in the house ambaye utafeel ya kwamba there's more information you need to add, please you can raise your hand, na si lazima awe ni specialist jamani, sije nikafungia wengine. Chochote ambacho kitaongewa hapa and you have information you feel you need to share, this is your space. Share it. You can either raise your hand ama uweze kushare kwa chat box. Labda nianze tu kwa swali la kwanza Brenda, ndio nisiweze kuweka watu sana. Labda tuzungumze what is trauma and how does trauma affect the structure and functioning of key brain regions. Hii trauma ni nini na ni vipi inatu affect sisi kwa jinsi tunavyo function katika brain zetu, na how does it affect the structures of our brain. Thank you so much. Karibu sana.
Okay, asante sana Mwanaisha for that question. So trauma ni kitu ambacho tumesikia mara nyingi kwa society na kwa community, tumesikia watu wakiongelea trauma. So I think it was very important for us to have this topic and understand what trauma is and how it affects us. So mara ya kwanza tunataka kudefine trauma ni nini. So trauma is deeply distressing and disturbing experience. Remember, is an experience ambayo ziko distressing na ni disturbing na zina overwhelm mtu and it affects the ability to cope. So hizi experiences zikifanyika, mtu anakuwa overwhelmed na they lose that ability to cope. And these experiences can be physical, They can be emotional and they can even be psychological. So mtu alikuwa ananiuliza saa zingine, when we talk about emotional and psychological, what are the differences? So tukiongelea about emotional, how the trauma can affect somebody emotional, emotional involves the feelings that comes with the trauma. And then psychological, this is the mental process that these feelings are causing somebody. So those are the two differences between emotional and psychological. Na tukiongelelea trauma, nataka kuongelea different types of trauma, kwa sababu hii itatusaidia sana kuelewa trauma ni nini. So tunataka kuongelelea tofauti, different types of trauma. Tuko na different types of trauma ambao tunapitia kwa community. So number one, we have acute trauma. This acute trauma is caused by one-time traumatic events. Remember tumesema trauma tumedefine kama these events that zinaleta distress and inafanya mtu lose your ability to cope. So tukiongelelea types of trauma, tuko na trauma ambayo inaitwa acute trauma yenye is caused by one-off event. For example, kitu kama accident imefanyikia mtu mara once. Tuko na vitu kama earthquakes na tuko na vitu kama floods. These things happen sudden, but acute ni ile kitu ambayo ilifanyika ni one traumatic event, ilifanyika mara moja. Alafu tuko na chronic or ongoing trauma. Chronic or ongoing trauma, this is a trauma. When we talk about the word chronic, tunajua hata tukiongelea zile chronic illnesses, ni zile illnesses ambazo tuko nazo na ni long term na mara mingi. So tukiongelelea chronic trauma, is also an example of ongoing trauma. Vitu kama domestic violence, hizi ni vitu ambazo zinakuwa repeated. Like abuse inakuwa repeated kila time. Vitu kama sexual abuse, tunapata mtu anapitia sexual abuse mara mingi. So tukiongelea chronic trauma, inaletiwa na hizi events zimekuwa repeated mara mingi. Na examples ni kama bullying, ni kama GBV. Hizo ni vitu ambazo mtu anapitia si mara ya kwanza, si mara ya pili. Then we have the complex trauma. Hii imefanyika umekuwa na multiple experiences over a long time. So especially during childhood, tuko na zile repeated things like maybe mtu amepitia neglect or certain types of abuse zenye zinafanyikia mtu. So these ones zinafanyika multiple times. And then we have secondary trauma. Secondary trauma huwa inaitwa, saa zingine tunaita vicarious trauma. And this is a trauma that is exposed. This is a trauma that a secondary person experience, like you experience trauma through somebody else. Like you see, maybe you have witnessed a trauma, or you've seen somebody going through a trauma, or you are a counselor like me, or you are a teacher, you are a social worker, then you are a journalist. The environment where you are working or where you live, somebody else is going through a trauma and you experience that trauma. So when you talk about trauma, I want us to also understand that the secondary trauma that you can experience by you getting exposed to that trauma, or even taking care of a sick person that has some chronic illnesses, you can get that secondary trauma. So another important trauma is developing trauma. Early childhood experiences such as neglect, we've talked about them. They can they can make a person develop a trauma that, this one, when we talk about developing trauma, we talk about this trauma that developed from childhood to now. So a child started maybe developing trauma, maybe from experiences with the primary caregivers, parents, maybe the parents were abusing drugs or had mental issues. This affects the child's brain, which we'll see when we will continue with the topic. So when I talk about trauma, I think these types of trauma really give us a good example, and for us to see, we've seen the examples, we've seen the types and the definition. I think from there we are able to understand what trauma is. Thank you.
Asante sana Brenda, nafikiri kwa udogo sana na kwa uchache umeweza kuelezea what trauma is, na pia kwa ile my little knowledge of trauma nafikiri umeziangazia almost all of them ambazo kwa namna moja ama nyingine zinatukumba kwa sisi kama binadamu na shughuli zetu za kila siku. Na I love this topic kwa sababu most of the times when the types of traumas are mentioned and given examples, you already see, you can also diagnose yourself and say, mimi, whatever I'm going through, I think I am suffering from this type of trauma. So that is number one awareness ambayo we normally encourage people to understand what type of trauma ambayo unaipitia so that you can start managing it. So thank you so much for that. Na pengine tu
Okay,
tukiangalia hapo hapo umezungumza about,
Mwanaisha,
yes Brenda?
kama
Yes.
hujaendelea, nafikiri kuna mahali sija
Mm-hmm.
highlight in the question that you asked me.
Mm-hmm.
Ulikuwa umeniuliza pia how does
Yes.
trauma affect the functioning of our brain. So tukiongelelea trauma,
Yes.
leo by the nataka kuambia wasikilizaji wetu, our topic is going about brain. So we are going to have maybe need to understand how our brain functions and how it affects also our mental health, because remember, when you talk about trauma, is also part of the mental health issues. So tukiongelea how trauma affect our regions, I'm going to talk about 4 regions that our brain has. Number one, there's one region that is the center of fear. You know, when we talk about trauma, remember we talked about traumatic events, and they come with a lot of things. So there is a region of our brain, there are 4 of them. One is the center of fear, another one is the center of memory, then another one is the center of thinking and control. So we are going to see then the last 4 category of our brain is the connectivity, because remember, our brain connects our body, connects to different parts of our bodies, and also send message and sensors to different functionality for our body to function. So we're going to see this 4 and how it affects us. So the center of fear, it's called amygdala. And when you experience trauma, it becomes hyperreactive, leading to exaggerated response to fear. For example, when something happens, maybe an accident, you see, for example, that is a traumatic event. So because this center of fear is affected, it becomes hyperactive. It becomes so active that it leads to exaggerated fear and responses. And that's why we've seen that sometimes an accident happens, tumesikianga hizi vitu tukisema mtu watu wanasema huyo mtu hata kuumia ni kushtuka tu. Ni kushtuka nilifanya this thing happens. So because that is our that part of brain, that is how it reacts every time trauma happens, because it's response to fear, it becomes so hyperactive. And then we have the second part, which is hypothalamus, which is the center of memory. So once you experience any type of trauma, it shrinks in size and functions, impairing the ability to differentiate between the past and the present danger. So you can't memorize. So it affects your memory. It affects the impairing ability to differentiate what has happened in the past and in the present danger. And then the third part that we talked about is the thinking and control, which decreases, it weakens the reasoning and the decision making. At that time, you can't make maybe the right decision, because your ability, your logical ability maybe to make decision has been affected. And also it also regulates your emotions. So at that time, your emotions are not regulated. So that's how it affects how somebody responds. That's why when there is maybe an accident, maybe something is happening out of fear and you are in that state where you can't control how you think, and your ability to think has been affected. You can't make the right decision. Maybe there's a fire. Instead of running through the door, maybe you are running towards where the fire is. And sometimes we ask that why is so and so running towards the fire? But it's because of this part of the brain that always get impaired when that thing happens, when any type of trauma happens. So you can't make a decision at that time, or you can't reason logically like any other person. And then we have the last part, which is called the corpus. This one may reduce the connectivity in communication. Remember, we said that our brain I know those who have done biology or doctors who are here can help us, that our brain sends messages to maybe between brain hemispheres, and they send communication. So when any trauma occurs, it will reduce the connectivity and it will disrupt the communication between your brain hemispheres. I know we know different part of the brains, but that is not part of our topic today. So those are part of the brains, and that is how trauma affect different part of the brains. And the reason why we have lighted these ones, because these are the ones that are related with our topic today. So there is the fear, and then there's memory, there is thinking and control, and then there is connectivity. So all those parts are affected, hence it affects how we respond to trauma. Thank you. Back to you, Mwanaisha.
Okay. Thank you so much Brenda. Nafikiri sasa hivi maswali mengine tutayapeleka haraka haraka kidogo, but also the audience, please feel free to react or comment on our chat box. In what ways, Brenda, does trauma disrupt memory processing and emotional regulations? Umezungumza about different parts of the brain and how they function, but tunataka tu uelezee kidogo, how does trauma disrupt memory processing and emotional regulations?
Thank you Mwanaisha. Tukienda haraka ndio pia wakati is not on our side. When you experience trauma, because we've talked about the function of the different brain aspects. So when you face trauma, it can cause intrusive memories instead of coherent memories. The difference between these two is intrusive memories. These are unwanted, broken pieces of traumatic event. You see, sometimes you may have gone through some traumatic events, but you still have this unwanted memory. Sometimes you don't even want to like these memories, they keep on coming. Maybe you've been raped before, but sometimes when you see it, you have these memories coming back, and they cause you a lot of triggers that bring you stress in your daily life. So it can cause intrusive memories, because we need to have that coherent memory where you can be able to tell the story clearly and the past experience and recall the purpose and understand what happened. But in this case, they bring you that intrusive memories that you have those episodes. And I can say that this sometimes we classify this under PTSD, post-traumatic stress disorders, where you keep on having the memories of the past experiences, worst experiences that you had, even through dreams. When you sit down, sometimes they come. And then another one, traumatic events, you may get some triggers and flashbacks sometimes. Like sometimes when maybe you see a similar things that has happened, maybe something happened somewhere, and then you went to another event, you see something that similarly reminding you of whatever has happened. That is what we call trigger. And then you may get triggers and flashbacks about whatever has happened. And then another part is overactive, making emotions like fear or anger or overwhelming. Where people are overactive, like after this, you become very overactive. Like you have so much fear, you have anger issues and aggressiveness, and also all these things are becoming overwhelming to someone. And then under function, reducing the ability to calm emotions down, because sometimes we are being told that sometimes somebody might tell you, oh, you need, maybe if you get these triggers, because there are people who get triggers and they get maybe anger issues, and people think that they can have that ability to control themselves. But because of the state where they are, they lose that ability to control their emotions and also maybe to calm down or anything or something like that. And then this leads to difficulty in distinguishing between real current threats and memories of the past. We've talked about that when we talk about the functions of the brain. And this one, because these things, I'm trying to explain them without mentioning the parts of the brain, but each one of them is under every part of the brain. Like when we talk about the last one, which is in charge of communication, and your brain lose the connectivity to communicate. And also this is where it can lead to difficulty to distinguish between the current threats and memories of the past, because you've lost that that connectivity to your brain to communicate to other parts of the brain. Thank you.
Thank you so much. You've reminded me of the lessons sometimes we learn sisi watu wa nitasemaje, civil societies ama nasahau hilo jina, but utapata we tell people huyu anaishi na survival brain kwa sababu they keep on seeing everything around them is red, so they keep on surviving every time yuko on their survival mode. And I think that is what we are talking about on the fourth part of the brain. And again utapata we say ama we learned ya kwamba pia when there's so much that happened to you ama trauma is still haijakuwa managed, ndio pale we change our belief system, we build defensive mechanisms so that we keep on surviving. Ndio maana mtu anakuwa short tempered ama unasema vile ambavyo umezungumza Brenda, ya kwamba yuko overly active kwa sababu anataka kuprove point, that is her ama his defensive mechanism of making sure ya kwamba no one atakuja again amwambie you are not good enough or you are small or that. Yeah, so thank you so much for that. You've reminded me a few lessons that I learned huko nyuma. And please let's remember kwamba our forever moderator, our charming moderator yupo ndani, Mahmud leo, but hasikii vizuri, anasoma huko kwa chat box. Kwa hivyo msikuache idol atafeel kwamba tumemwacha sana leo. Hapo flu imembana mpaka sauti haitoki, kwa hivyo tunamwambia pole. Na pia kama unapenda na umemiss sana, unaweza kuandika pia kwa chat box umwambie pole, ili kwamba aweze kuendelea vizuri next Tuesday tukuwe na yeye. Na pengine niende kwa the third question, Brenda, how can early childhood trauma shape long-term brain development and behavioral patterns in adulthood? Kwa sababu tunasikia terms huku nje, wewe una child trauma zako usiniletee. So how does that in a shape the childhood traumas in a shape our long-term brain development and behavioral patterns in adulthood?
Okay, thank you so much, Mwanaisha. So I think this is a topic that we've had so many people saying that, oh, I have childhood traumas, and it's a common thing that we've had. So you see, when a child is young, their brain is still developing, and at that time, their brain is highly sensitive, and at this rate, they might absorb a lot of trauma. And remember, there's a time we're talking about mental health issues here, and I remember Madame Doris explaining that even children go through mental issues, and children have stress, children have depression. So it's the same way children can also go through trauma. So during this time that their brains are developing, their brain capture a lot because their brain is highly sensitive and highly active. So one of the things that can lead, you see, when a child is young and maybe they are facing trauma, this can actually lead to highlighted sensitivity to stress and difficulty to calm down. I talked about that functions of the brain when we are starting, because when a child is young, and remember I talked about attachment, I think we talked about, there's something called attachment styles. And when a child is growing up, when they are young, that there are so much of attachment styles that they might experience, and this is because of what the primary caregivers maybe are going through. Maybe their primary caregivers are maybe having maybe the issues of drugs, maybe they are struggling with mental health issues, maybe there's domestic violence in that family, there is bullying. This will always stick in that child's brain, and when the child is growing up, it will manifest this thing by having this type of personality, maybe issues like anger issues, maybe difficulty to calm down, maybe sensitive to stress because of the way upbringing and exposure that they have gone through. Because remember, these things also affect child. Depression will affect children. And remember, we say that if mental health issues are not handled at an early stage, it will always rupture when maybe you grow up. At some point, italipuka. So this is when we talked about that one. Then also I talked about attachment styles. So my next point is to create attachment difficulty. Remember I talked about this attachment style when a child is growing up, the mother or the primary caregivers or the teacher, those who are close to the child, the behaviors that they portray affects a child's behavior. How the child will trust things, how the child will handle things, it will depend on the whatever traumas they went through or issues that they were around them while they're growing up. Then also there's increased risk for maladaptive coping behaviors. Remember, when we talked about development stages, and we normally say that whatever the way your brain is developing, and maybe a child has gone through some stressors, they were not able to deal with them when they are young, so they grow up with these issues, and that's why sometimes you find children developing some funny behaviors like aggression, substance use out of nowhere. And that's why when you go for therapy, most of the time, you'll find therapists going through the roots. Like when you go for systematic therapies, they'll go through a systematic therapy where they go and start the family tree and see where if you had childhood traumas. So when you come and we draw the tree to look at the childhood traumas, those are the things we are looking at. What other things that you went through, because some people engage in certain behaviors now, and it's because of those traumatic events that they experienced while they're young and they have never dealt with them. And then another one, contribute to mental health issues like depression, anxiety, PTSD. We've seen people who are experiencing PTSD. A child is just having a certain dream every night, they're crying at night, they're telling a story. Maybe it's something that happens when they're young and it keep on coming. When you're having PTSD, it can even come as a sign of dreams. You're dreaming about a certain scenario, and that scenario maybe it happened a long time ago. So you keep on having those issues. And then the last one is borderline personality traits. This is a mental health condition that is characterized by instability in emotions and self-image and relationship, leading to impulsive, intense mood swings and fear of abandonment. So this type of people are the people who have like they have like issues of self-esteem, they have issues of negative self-view, and most of them end up in like losing hope and committing suicide because of the issue they have with themselves personally. So back to you, Mwanaisha.
Yeah, thank you so much Brenda. Nafikiri ulipokuwa unaongea it reminds me of some of the things that we normally pinpoint huku nje out of maybe unknowingly nitasema. Sometimes we see people labda ni mtu mzima ana behave na behavior za kitoto, ama anapenda mchezo sana, ama pengine anapenda, nitasema sitaki kusema kulia kwa sababu kulia it is okay, it is normal, but either kijana nasema mwanamume utapata ako 50s lakini ameanza tabia za kibarobaro, hata mavazi and all that. Does this apply here kwamba development yake ya brain iliharibika hapo katikati kwa sababu ya traumas ambazo alizipitia akiwa mtoto, na ndio maana pia behaviors tunaziona, tunazipinpoint, tunasema huyu ana tabia za kitoto, huyu kuna mahali, kuna stage aliruka huyu, sasa hivi kwa mtu mzima anarudi kwenye ile stage. Is it something like this that you were talking about, Brenda?
Yes, Mwanaisha. Examples kama hizo, jukumbuka nimesema ya kwamba when you go to see this maybe therapist, and you will find a child are having certain issues, certain behaviors that you wonder where the behaviors are coming from. And sometimes it's not even peer pressure. Sometimes they are responding to the past traumas that they have experienced. And that's why sometimes as therapists, we have to go back to the childhood trauma so that we can help the person to deal with their childhood traumas so that they are able to now cope.
Asante sana. Thank you so much. Ndio maana majenzi siku hizi wanasema I don't want to have a man mwenye ambaye anataka mimi nikuwe kama mamake because they are behaving like a child. But I think ni kukosa kuelewa tu ya kwamba kuna traumas ambazo anazipitia kwa namna moja ama nyingine. Aya, guys, I think
Mwanaisha, pia saa zingine wajakuwa wamepitia kuna ile exposed trauma ambayo umeona mtu mwingine na wewe umekuwa karibu na maybe uliona mamako akipitia. Sasa kama hiyo example umepeana ya maybe ndoa, unapata maybe aliona mtu mwingine apitia mamake, ameona sister yake, so tuko na ile exposed trauma ile unapata through exposure. Unaweza kuona umedeal nayo, umekuwa primary caregiver wa huyo mtu, so kuna hiyo pia that kind of trauma.
Thank you so much. I wish we can get another platform tuweze kudadavua zaidi on that, kwa sababu we are misusing some of these terms and words and experiences ambazo tunaziona hapo nje, and we have a lot of people who need attention ya kuweza kusaidika kwa namna moja ama nyingine. So thank you so much for that. Nafikiri pia our chat box jamani tuweze kuitumia. You can pinpoint some of the patterns ama behavioral patterns za adults ambazo tunaziona ambazo zina tell signs ambazo someone ameweza kukuwa affected in kwa namna moja ama nyingine on the development of their brain akiwa anasumbuliwa na childhood traumas. Kwa hivyo let's talk. This is our platform to talk and also to learn from each other. And to the other question, Brenda, what role do stress hormones like cortisol play in linking traumatic experiences to change in brain functioning and behavior?
Okay, thank you, Mwanaisha. But I've seen somebody raise their hand. I don't know whether they have a question or addition. They can maybe raise their question. Maybe it's something to add on what we are talking about. Esther, please.
Okay, mine was just to ask,
Yes.
because you said about the trauma and yes, mine is just a question. Like, can someone get fixation due to trauma? Like, when someone gets to be fixated at the oral stage, can that be a result of trauma?
Yes, it can be a result of trauma.
Okay, and another question here is, there is some time back where I went to hospital and I was told like there's something like PTSD headache, and I'm like, how is PTSD headache related? Like, inakuja aje in someone's whatever, and maybe I myself naona I don't have any traumatic experience. Like, I still don't know the root cause of PTSD, like in terms of headache.
Yes, that's why we are saying that most of us might be, if you saw a doctor who diagnosed with that, you see sometimes we might go through certain traumas. Maybe you underwent a trauma and you didn't know whether that trauma affected you. So one of the PTSD is a disorder, that is called post-traumatic stress disorder. And one of the symptoms of post-traumatic stress disorders is headache, it's lack of sleep, it's overeating, lack of not eating. So those are one of the symptoms of PTSD. And yes, if the doctor maybe diagnosed you with that, because I don't want to like go through the diagnosis and maybe say, maybe the doctor had the reasons why it gave you that diagnosis. If it was a psychiatric, maybe because of the assessment they have done, and maybe through the history, I don't know whether the doctor took history, so they were able to tell that maybe you have some underlying issue that you are dealing with. Maybe you are not aware. Sometimes we undergo through traumatic events and we are not aware, because we are not aware that that is what is affecting us. And that's why I talk the issue of behaviors. You find someone having certain behaviors now, and it's as a result of whatever had happened before. So I'll also give Doris, I can see her hands are up, so that she can also give a point on that. Doris, welcome.
Yeah, thank you so much. Poleni, nilikuwa na challenges za mitambo, but I'm here now. I want to add on to whatever the lady was asking about the diagnosis of PTSD. It is very normal for someone to be diagnosed with a mental health issue. And most of the time, the mental health issues we have or diagnosed with, huwa hatuwezi trace kwa urahisi the origin, because in most cases life zetu tumezichukulia kama casual. You know, as Africans, as human beings wa Africa, we don't really put into emphasis issues of mental health. Now, we really didn't know that those issues can cause ABCD, or there are things to do with ABCD and it will affect me later. So the best advice I would give the lady is, if the doctor diagnosed you with the possibility of PTSD, if you want to deal with it or you want to handle it, you'd rather now register for counseling or be referred for counseling services, because already the doctor has diagnosed you. Maybe he did he did
Assessment.
an assessment, psychological assessment, because the assessments that are being done. If he did not do the assessment, he maybe assumed, because I have a client with similar case, that they have a problem since 2019, is a boy, since 2019 was diagnosed, was not diagnosed, but the doctor assumed or said or suggested that the boy might be having stomach pain, regular and very continuous pain, because of stress related issues or psychological issues, because he was screened all these things, but the body is okay, the organs are okay, everything is okay, but the boy has got a lot of pain in the stomach, and he can no longer withstand the pain since 2019 up to date. And the doctor is saying seriously, there is nothing wrong with the body, there's nothing wrong with the functioning of the body, they cannot see anything, they have done all the tests, they have done all the screening, but in real sense the boy is in pain. And now the doctors are saying, okay, we assume or we suggest this person be taken for therapy so that it can be diagnosed. It could be something to do with their psychological needs or stress or whatever needs, which is possible. And in many cases, the clients do not know where it started. They can't even remember, they can't even recall what happened or what trauma they went through, or they might be recalling, but they not categorize it as trauma or a traumatic event or something that can cause, such issues. Even simple stress or stress-related disorders can cause a lot of pain to the body and health-related issues, that even when most of people who have ulcer, who have high blood pressure issues, sugar issues, and all these other issues, it could probably originate from a psychological issue from the word go, but then the body started, being affected, the functioning of the body was affected, the brain and what have you, and then it leads now into other diseases or other symptoms that are physical symptoms. So I'd suggest the lady start seeking psychological services. It could be in a hospital, it could be private, it could be wherever you get the service, so that you can now undergo assessment, psychological assessment, and thereof, then if it is diagnosed properly, you can now start therapy and all these symptoms might go away. Thank you so much.
Okay, thank you so much.
Asante sana Doris and Brenda. I think because of time, pole sana Brenda, uta add on as you answer the fourth question ambayo nilikuwa nimeuliza kwa sababu ya muda. Thank you so much Doris, we ni wa maana sana kuwa hapa, so asante sana kwa kila siku kufika na kuweza kutufunza, maanake tunafunzika kweli kila siku. Doris, Doris, sorry. Brenda, I had asked the question ya kwamba what role do stress hormone like cortisol play in linking traumatic experiences to changes in brain functioning and behavior?
Okay, thank you so much, Manaisha. I think the topic of today is very interesting, and that's why we are having so much question. But because of time, we shall proceed. So before I proceed, I just also want to add the lady, if she's under your Samba Sports, me and Doris can also talk to her later and also understand maybe where did she get maybe to advise better, because I understand there are some of the things that she might not open up on this platform, but later on she can talk to me and Doris so that we can understand where she's coming from with the details that she cannot disclose here, so that we can give her the best advice based on that. So thank you. And then when we talk about brain and communication, because remember I talked about that our brain communicates to different parts of the brain and leads to functionality of different parts that we had mentioned. And we have stress hormones, and these are chemical messengers that play a role in our body and in our body's physiology and also our behaviors. Remember, Doris talked about just now about the physical aspect of when you have mental health issues. They lead to physical symptoms, and that's why sometimes you are sick and go to the hospital, you did all the tests, malaria, there's no malaria, typhoid and all these things, there's no any other sickness, and that's why people end up going to some other places because now they think this is not normal. But remember, mental health issues can also bring these other issues. So we have hormones in our body, and one of the main hormone is cortisol, and we are going to see how this hormone play a role in our body when it comes to stress and trauma. So cortisol is the main hormone for stress, and it's released during traumatic experiences. When an experience occurs, like we give about so many differences, like bullying, we give like somebody beating you, like a trauma can be, remember we talked about those things like earthquakes, which is not normal, floods, we have fire. So when these things happens, and we have that hormones that is being released, and that hormone is called cortisol, which is the main hormone, but we have other different stress hormones. So short term, cortisol helps the body to respond to danger. Remember, tuko na zile two responses, flight or fight. So when this hormone is being reduced, is being released, like for short term, it can help the body to respond to danger. But kuna zile long term or repeated traumas. Tuliongelelea zile trauma ambazo zinaokaa mara mingi. So inamaanisha ikiokaa mara mingi, hii stress hormone inakuwa released mara mingi. And now this can cause chronic high, it can cause now a chronic high cortisol, because now it's not going to be good for your body. Remember, when it is short term, it can help the body to respond. But when you have now different repeated trauma, now your body every time is releasing this hormone for a long time, then it can cause danger to your body. And how can it endanger your body? Number one, we talked about different parts, like our memory. We talk about hypothalamus, which is the memory of maybe our brain. So when this hormones is being reduced, like mara mingi, it can cause your memory, an impairment of your memory and learning. So it slows how things happens, how you respond to everything. And because now it is now excess in your body, it has been released in so many times. So it damages the functions of hippocampus. And then another thing, it's also reinforce fear responses. When this hormone can also reinforce fear responses, because remember we have that part of the brain that is responsible for fear. When anything happens, it responds. So when this hormone is released, it keeps that part of the brain to respond to fear. So it can either be, when it is released on a higher level, it can be on the hyper side. So you will respond hyper on the hyper side or on the lower side. And then the last one, it weakens the self-control. Remember tulikuwa tumeongelelea ile part ambayo uko na something has happened and then you need to respond. Kuna ile part ya how to make decision, or how are you going to control yourself, the calmness. So when this stress hormone is also responsible for that. So when it is released, like I've said, that for long term, it also affects, it weakens your self-control and emotional regulation. How are you going to regulate your emotion? And that's why sometimes we have the extreme issues like mood disorders, where people have, there's a lot of stress hormones that have been released in your body, and it can lead to emotional regulation, where people cannot even control their mood. Right now you are okay, the next minute maybe you have that mood issues, and maybe it's not because you have stress. You see, this is one of the biological causes that we talked about when we talk about mental health. So you can experience this, you don't have stress, you don't have anything, but because that hormones has been released in excess, it regulates your emotions. So you can either have mood disorders, you have different emotions. Somebody can even start crying. That's why we find even people crying. There's nothing has happened. They're just feeling emotional and they are crying. So those are some of the function of this hormone. So back to you, Mwanaisha.
Asante sana Brenda, well elaborated. Thank you so much. Nitaenda kwa the next question, alafu I'll go through the, after usha respond, I'll go through the chats kama kuna maswali, so that we wind up with answering the questions in our chat box. Na kuna swali hapa linasema, how do trauma related brain changes contribute to mental health conditions such as anxiety, depression, or post-traumatic stress disorder? I think this you have answered it in a way, but you can elaborate a few things ambazo labda you had not talked about. Karibu sana Brenda.
Okay, thank you so much. So I think this one we've talked about it when we were elaborating functions of the brain and these parts of the brain. So when we talk about PTSD, we said this is post-traumatic stress disorders, and we are going to talk about impaired hypothalamus. Today I said we are going to use terms. I was really trying to avoid these terms, but because we're talking about the brain, we cannot avoid some terms. So impaired hypothalamus leads to flashbacks and intrusive memories. Remember, when I talked about PTSD, we said that PTSD is when someone is having maybe you have undergone. That's why it's called post stress. When after the It's called after the trauma. Now you have that condition where you still think about that trauma. You have flashbacks of the trauma, and it can be very extreme. Where you remember this one is because of the impaired hypothalamus, which is in charge of memory in our brain. So when it is impaired, it leads to the flashbacks and intrusive memories, and that's why we have PTSD. And you start having flashbacks, you start dreaming of the event, you start every time you sit, you thinking of that because your memories has been impaired due to the trauma. And then we have depression. Also depression, we are going to talk about hypothalamus, which is the main part. Remember, is the one that is charge of memory. So shrinking of hypothalamus, it will shrink when there is a stress, and then there is a slow serotonin regulation. Serotonin is an hormone, and remember I talked about different hormones. We have different hormones when you're talking about stress, and I talked about the one we talked about, cortisol, is the main one. So when you have low serotonin in the body, and chronic stress hormones contribute to hopelessness, loss of interest, low moods. Remember when we have low remember we talked about when these hormones are produced in our body, sometimes they might be excess, because remember, even we talked about the issue of hormonal imbalance when you have excess hormones. So the hormones should be moderate. So when they are not moderate, you will start having issues like maybe low energies, low mood swings, you become emotional, you start getting depression-like symptoms. And when those things happen, then sometimes you really need to go through therapy and something so that you get help. And when I'm glad that we're talking about the issues of brain, because they're really bringing the aspect of biological issues of stress. Yeah, because when you find somebody crying, sometimes si mtu amekufa. When you find people they wake up in the morning, they're not talking to you. Maybe they don't feel like talking to anyone. They want to withdraw. Sometimes these things are being caused by the hormonal imbalances in our body. And we talk about hormonal imbalance. Sometimes it's not only, we normally know that hormonal imbalance are women issues, you see, like women are the ones to have those issues, but sometimes you can have these stress hormones. They can also imbalance, and they can cause you different mental health issues. And then anxiety. Remember, anxiety these are panic attacks, fear, worry. So this one is caused by the overreactive of this part called amygdala. Amygdala is fear, is in control of fear. So when it overreacts is when you start having worry, you become hyper, you start having panic attacks. So all these things, they are caused by malfunctionings of this brain, of these 4 parts of the brain. remember they have they have functions. So if one of them is maybe overwhelmed or fail or do like for the example, the amygdala is just supposed to control fear. So if it is overreactive, then that means it is going to overdo the normal function. So that's when you start having maybe high anxiety, because when you have fear, you start having anxiety, and you have fear like high level of anxiety, high level of maybe panic attacks, worrying, and that is what anxiety is. So I think I've explained how the three and how it is related within the brain and the. Thank you. Back to you, Manaisha.
Asante sana, Brenda. You've really explained so well. And I also want to appreciate Doris for the good job that she's doing on the chat box, kwa sababu kumekuwa na maswali huku na comments na reactions ambazo Doris has been responding so well to them. So thank you so much, Doris. Naona kina Riziki Makusirikwa hapa, kina Omar Changu, kina Florence Nahayo. Please continue talking huko, and Doris will be there to serve you, and I know she will serve you well. So thank you so much for that. Labda tuende tu for the second last question, ama the last question ambayo inasema, then all this that you have explained, tumejifundisha about functions of the brain, types of the brain, tukajua namna how the trauma disrupts our processing and emotional regulation, our childhood trauma, how it shapes our brain development, all this, stress hormones and all that. Then what can we do to manage trauma so that it does not affect our ways of life?
Okay, thanks you, Manaisha. So number one, this is a very important question, because you see, trauma can deeply affect how we think, how we feel, how we act. But the good news is that there are different approaches that we can do to impact our daily life and how we can manage trauma, because there are so many people are living with trauma, but there are things you can do maybe here and there to manage the trauma and even heal from trauma. I know somebody had asked in the question if somebody can heal, and I know Doris is there to answer. So number one, we have to acknowledge and understand the trauma. Remember, tunasemanga kila siku, the first stage of mental health is acceptance. You can't take somebody by force to therapy. You can't take somebody by force to seek help. They'll go and they'll pretend. So the first thing that I would like to maybe to urge everyone is to acknowledge and understand the trauma. Recognize what has happened was difficult, and that it is not normal. The way we are responding, our responses are normal, and sometimes they overwhelm us. But when we come to a point of understanding, to acknowledge and understand what happened to us, it will be the first stage of healing. We will be able to seek professional support, which is number two. Number one, if you acknowledge and understand what happened, and then we know what happened, it was difficult, and even the way you respond now and react, it is acceptable. But now this will help you to seek professional support. How do you seek professional support? You seek professional support by going to therapy, like CBT. What we normally do, you come for therapy. We do therapy where you are able to handle your past experiences. We walk through the journey so that you heal through the trauma. So yes, somebody can heal through the trauma when you go through a therapy or counseling. And sometimes it goes to beyond maybe seeing a psychiatric, which also is also a doctor, because when you talked about the issues of hormones and those the hormones and imbalances, then there you need to see a doctor who's a mental health doctor. A psychiatric will also give you interventions. And then another one is building healthy coping mechanisms. For example, there are so many things you can do, like maybe do things like deep breathing, maybe because remember we said when you have trauma, they can manifest differently. Like you can have anger issues, you can have deep anxiety, So sometimes you can do ground techniques like, I know everybody knows this exercise of deep breathing. Here you breathe in. Sometimes somebody has done something and you are so upset and you don't know what to do and you don't know how to control your emotion. You don't know how to calm yourself down. So you can always have that deep breathing and then you breathe out. It sometimes help us to relax. So sometimes, Mwanaisha, when you guys have maybe a physical session, you can do that practice of breathing in and breathing out. It actually helps a lot in when you have a trigger, because we say when you're going through trauma, you can face certain triggers on the way. So when you're having these triggers, you can always do that to help you calm down. It's not healing you, but to help you calm down. And then another one is strengthening social connection. We've talked about this one every day. Share your feelings with your trusted friends. People, we are social beings. Human beings are social beings, so we need to have friends, families, people we can talk to, as in a safe space. Somebody that when you talk to, you feel is a safe space. And also support group. We have support groups. Like I know Samba Sport, last time when we are when we are engaging with your staff, there's that aspect where I had this like a support group where people connect and I've walked through a journey. So I like this platform we have is a very, very good platform. And then also care for the body. Remember, we've said these things, they also leads to physical, they also affect our physical body. So also prioritize on how to take care of your body, like prioritizing exercise, good sleep. Remember, sleep is very important to have enough sleep. If you don't have enough sleep, it's going to also to affect your brain and how your body functions. So these are like doing exercise to it will help you release some stress, and also prioritizing having enough sleep and rest, and also learn stress management. Last time we talked about different stress management skills. So you can also, because when you have trauma, of course, sometimes it will come with stress as a symptom. So when you have stress management skills, it will help you to reduce triggers, because you'll always, when you have trauma that you are not healed, you'll always face triggers right now and there. So when you face such triggers, are you going to break down? Sometimes you can do these stress management skills that we have, and they can help you relax when you have those triggers. And then the last one, focus on growth and resilience. Resilience is the ability to bounce back. We know that you might go through so many issues. You are in a problem. Do you have that ability, that resilience, ability to continue, grow up? You continue and focus on your growth, because when you're having trauma, you're going to have triggers, things that will be pulling you back. But if you have that resilience, it will help you to focus on the growth instead of now having trigger and going back to square one. Maybe you're going through therapy and you are in maybe 1 to 10, you are in 6, and then you face a trigger, you go back to 1. You see, so there will not be healing taking place. But when you have resilience, you'll be able to handle your triggers and focus on your growth, so that if you're in 7, you face triggers, you are still in 0.7, and at that we continue to move. So I think so far those are the main ways that we can handle trauma. And thank you very much. Back to you, Mwanaisha or Doris, for any additional.
Asante. Asante sana. Thank you so much, Brenda, for finishing up so well na kutukumbusha the things that we are supposed to do to make sure kwamba our mental well-being remains well. So ningeomba tu for Brenda, you give us your final remarks, na Doris pia naye you give us your final remarks through the chat, so that tuweze kuokoa muda, tusiache watu. Tumeambiwa we prioritize sleep. I want people today to sleep early, so that's why I am saying, Brenda, you give your final remarks, na dadangu, my super guest atupatie remarks hapa kwa chat box, tutaweza kuzisoma insha Allah.
Okay, thank you so much, Manaisha. I want to thank everyone for joining the session. It was a very technical question, the session today, because it was like more of biology, but I know we've done well and we've understood how our brain works, and it plays a big role when it comes to trauma. So I know each one of us, not everyone has gone through trauma, but most of us have gone through different traumas because we've talked about them and you know where you are yourself. So just know that the first stage that I want to insist on is acceptance. Acknowledge the trauma so that you are able to deal with them. Acknowledgement plays a very big role even in mental illness, like like wellness. When you want to heal from anything, number one, you have to accept your acceptance first stage so that you proceed to the next stage. So let's learn to acknowledge our issues, our traumas, our stressors, so that we are able to deal with them. And it also help even as therapy, and everybody else is going to assist you. When if you have acknowledged, even our work will be easy for us to assist you. So with those few remarks, thank you everyone, and thank you, Sambat Sports, for having me.
Thank you so much. Asante sana Brenda. We will always get back to you. And kama ulivyotangulia kusema, well, we are talking with Esther. If Esther, you need to reach out to Brenda Amadoris for more consultation or engagement, we'll be able to link you up in case you don't have their contacts or you don't know their whereabouts. And nitasoma comment moja kwa sababu Doris amenifanyia kazi poa sana huku kwenye comment section kuansa na kugive remarks to everyone ambaye amekuwa na maswali ama amereact, na yeye pia akatupatia her final remark, akasema I am happy that we engage in this session. More insight may be found on books and websites. Let's go back and read about this for our own benefit. Trauma is real and everyone deals with it differently. Know you are unique, and people differ. Thank you so much for this. I think this is a motivation for tonight. And we are grateful to have you two beautiful ladies who are very knowledgeable in this. You giving us this space to learn and also to remind ourselves on the things ambazo zinatufanya tukue mentally well. Na mimi pia niseme for tonight, because tumeambiwa ya kwamba we maintain our mental well-being. So ikiwa you have a partner tonight, this is an assignment for tonight. Nita ask next Tuesday wale ambao nitawaona tena. Kama uko na partner nyumbani leo, nitaomba ukitoka kwenye hii tu chat, nende ukamuhug. Give them like a 1 minute hug. Just a 1 minute hug. Feel good about that hug. Don't think about anything else. Just feel that person next to you if you have a partner. If you don't have a partner, then I want you to be intentional today. Do something that will make you happy. If ni kwenda kaa kwa choo, uoge for a whole 1 hour before you go for bed, please do so. If you can't take a bath for an hour because you're sharing that bathroom with someone else, you can also say today hakuna kuingia TikTok, hakuna kuingia kwa kuangalia movie. You want to sleep early, just sleep early. Just do something that will make you happy. Pengine kuna mayai, ulinunua kreti ya mayai na haujawahi kula au mayai tokea huu mwezi uanze, yako tunaona yanaisha na hujai kula. Kama unaweza jikarangie, kula before you go to bed. But just do something that will make you happy for yourself today. Be intentional, and I love you all, and take care of yourself, na tukutane tena next Tuesday same time, tuje tufunzane, tuelimishane, na to continue spreading the word to other people. Thank you so much and have a lovely night.